All right, Jill, we're just going to go for a quick coffee and we'll be back. All right. Well, here right now with Dr. Manny Alvaro. Manny, say hi to our audience.
Hi. Hi, everyone.
So Manny was giving a talk today, this morning, to the program. Came down from Montreal to visit us. And I told him to come join me here, and we're going to go for a quick little coffee and maybe discuss a couple of things about...
Something we'll think about. It might be interesting.
Yeah, we got some live music. That was a glorious day, huh? It's not often that you get 70-degree weather here in Boston.
Well, up in Montreal, it's pretty cool. It's cold. I guess we're going to be getting this nice weather.
Cold?
It's still cold.
Well, for the record, it is almost like mid-June time.
June 6, 7 today. So
it's got beautiful weather and lots of people around. It's usually what you get in Boston, Manny. I'm sure it's the same in Montreal.
well,
it's
you
such
guys.
a miserable winter. Every time the weather gets a little bit nice, everyone just starts coming out. All right, if you want something casual, this Finagle bagel.
The old Finagle bagel.
They have little bagels and just coffee. It's pretty nice
I
and
need
casual.
my mid-afternoon coffee. I have to respect my Italian origins.
That's right.
These bagels look so good.
Yeah, the bagels are really good here.
Even if Montreal is
the morning time.
famous for their bagels, these ones look more appetizing.
Oh, that's it.
So it's done.
Should have accepted moving.
Oh, Bailey, you don't want to be outside.
We're on
In
the
front of
park.
the church or something?
Yeah, we could be on the park.
That could be really nice inside there. That's nice.
Alrighty, Manny, so we finally found a little
Another
not so
place.
quiet place. It's
Or-
been like running around everywhere, finding a place where we can have a conversation. It's a beautiful day, so it's super busy
Without the fear
Yeah.
of getting kicked out.
without getting kicked out. So, Manny, tell me your talk this morning. Let's talk about a topic that oftentimes comes up. I would love to ask you your opinions about an old saying about crowns. That
Yes.
Following endodontic therapy, all posterior teeth require a crown. What do you think about that?
It's more of a perception, not a fact.
Okay.
So the perception is that a tooth that had a root canal treatment will require a crown, and that's more of a perception, because the fact is that not all teeth that have a root canal treatment require a crown.
Now,
It's more of a case by case.
Sure.
And
So first of all, let's kind of quickly review that the reason for a crown is to help address some of the biomechanical deficiencies of teeth that have been heavily restored.
yes,
And root canal therapy, in a sense, is done on teeth that are generally heavily restored. So they are lacking in their optimized biomechanics.
okay,
Right?
Yeah. In other words, if just the access, let's say an occlusal, the access cavity of for a root canal treatment on an intact molar, you lose 5%
Right.
of its stiffness. And we're not talking about dentin. So we spoke about that today.
Right.
Dentin stays the same. It's the tooth structure. You're losing tooth structure, so the actual tooth becomes more fragile biomechanically.
Yeah, previously people had this myth that
That dentin are
dentin,
more
root canal
brittle.
treated tooth
That
is
dentin's
more
not
brittle
brittle.
because dentin loses its characteristics. And although there have been a couple of, as usual, like any kind of piece of research, you'll have, some articles that say one thing and then other articles say the opposite thing. So just kind of, that's the wonders of
we'll tell them, we'll keep it
dentistry.
straight. No, teeth, dentin, of endodontically treated teeth are not more brittle.
They're not more brittle. Certainly not. But if there is any weakness in the tooth, it's because generally of the reasons for which root canal therapy was needed, which is the loss of tooth structure due to large restorations or caries, and that's why root canal therapy was needed. So the root canal is not the cause, it is a correlation of the effect, correct, of being there, root canal therapy being done on those teeth. Okay, so that's the basis of teeth needing a crown. Having said that, what's the origin of the old thing with the posterior teeth requiring crowns?
Okay, so it's because they thought teeth were more brittle, but they're not more brittle, and there's probably some sort of misconception about that. For instance, a molar that has an MO or a DO. Okay, a tooth with an M or DO tooth
Right.
surface where the patient does not display any evidence of parafunction like
Right.
bruxism, and where the occlusal scheme is more of a canine rise or anterior guidance. Case like so, this tooth does not need a crown after root canal treatment. So basically, you can go directly with a direct restoration on, let's say, a molar with an MO or DO in a case where there's no parafunction and the occlusal scheme is more of an anterior guidance or canine guidance, provided you kept enough tooth structure
Right.
buccolingually.
Exactly.
Yeah.
So the
Yes.
two key points are, first of all, any rule that applies, a broad brush of a rule that applies to everyone, works well at the undergraduate level where people need to have a rule that applies to everything. But once you get experience and come out clinically, you realize that you can't treat everyone the same way, that there are specifics, and that's the whole idea of personalized medicine, the idea that you are you're trying to make a decision for a given patient based on the specific factors that are involved for that given patient. So if a tooth does not lack, is basically has at least a 1.5 millimeter of dentin and enamel walls, the thickness of the walls on the buccal and the lingual side, that tooth has adequate structural integrity. The presence of either the mesial or the distal marginal ridges, or ideally both, is another huge factor.
Yes.
But also, it's important to also realize that the patient's occlusal profile is an important factor too. So as you mentioned, whether a patient is suffering from, bruxism and has a group function, type of a profile, well, those teeth may require more protection than somebody who has a generally abnormal canine rise type of an occlusion doesn't have a problem.
The point
These are important
we have to
factors.
bring out is the why. Why do we have to? Why avoid a crown?
We should
If
avoid a crown so that we can preserve
Why
the
the
tooth
overture?
structure.
Exactly, so
That
we can
is-
keep it longer in life, because this crown, it's not a definite restoration. After 10 to 15 years, you can start getting coronal leakage, caries, then you need to remove the decay, remove the crown, sometimes retreat the root canal treatment. But if you started with a crown right off the bat at an early stage in life, there's not going to be enough tooth structure and ferrule to provide for a second crown and push this crown, this tooth, further down in life. If we can avoid an implant early on in life, why not? Because an
Right.
implant, there is maintenance and all that. So we can push it up and later on in life.
It is so true. I mean, every restoration we do has a lifespan. So the later someone gets on this conveyor belt of treatment, the better off they are. Of course, not on the part of the patient doesn't mean they should procrastinate,
Yeah.
because the main thing with dental disease is that it's almost always preventable. And when it does occur, if it's arrested in the early stages, that's really the only way to prevent it from progressing and becoming more advanced. And that's a key thing to keep in mind.
The analogy I give to that is when you fracture your when you have a femoral fracture, femoral
Yeah.
neck fracture, what physicians will do, let's say you have it at the age of 50, what they'll try and do is prevent a total hip implant. Because if you have to do a total hip implant at the age of 50, by the time you're 65 and you need another hip implant, by the time you're 70, you're going to be on a wheelchair. So what they do is they pin it. They put 3 pins to avoid a total hip implant. So you can push that total hip implant later on in life and not early on. And so that, I don't know if it's a good analogy, but it makes sense.
No, it is. It's absolutely true. I mean, the later you do any of these complicated treatments, the better off you are, because as I mentioned, everything has a lifespan. So, including ourselves. So the whole goal is to have the complicated stuff much later in life.
But then again, there's the argument you don't want to do it too far down, where you're not physiologically
too medically compromised to have it done.
not to do it. But the thing
that's
is,
a different
an
discussion.
implant has a certain maintenance, and it's known that the maintenance of an implant you get after 9 years. There's evidence that you get periodontal disease around implants, and then if you can push the implant further down, or further down than your lifespan.
Yeah,
the
absolutely.
better it is.
So I think it really comes down to the whole idea that a rule such as all posterior teeth requiring root canal therapy is just, a guideline, a basic guideline. So basically, the conclusion is that when the old rule that all posterior teeth requiring root canal therapy should be restored with a crown is as you said, is merely a guideline and a perception. The reality of it is, in modern days, you have to make a decision based on an individual patient, customize the treatment based on the amount of dentin structure, dentin enamel that is remaining, as well as their occlusal profile. Of course, cost and finances are a factor as well. And so let's not go by any rule, but rather make a decision that is based on individuals.
So can I
we
just say,
the ambulance is coming?
Can I say, while the ambulance
coming
is
to
coming,
get us because we're talking.
In front of the light. Can I just say it briefly? So if you have a root canal treatment, but you only have two surfaces, MO or DO, no parafunction. There's no parafunction, and you have either anterior guidance or canine guidance. In a situation like that, you don't need a crown after a root canal treatment.
It's the cops, man. We got to get out of here.
We gotta go.
They're coming to get us.
Gotta go.
So,
they're gone.
All right. So no such rule. Follow your, your training and your wisdom and knowledge of the biomechanics of any given tooth based on a given patient, and look at the whole picture and not just a generalized broad brush. And until then, I want to thank Dr. Emmanuel Alvaro, having come all the way from Montreal to teach here at our school. With the postdocs, they all appreciate it. It's great to have your knowledge and experience to add to this educational kind of journey for them. And thanks again, Manny, for joining me.
Thank you for sharing.
Absolutely. And for Endo, I'm Nasse. Have a safe